Today we are going to see about the posterior compartment of neck. So possible questions from the posterior compartment of neck is, it can be asked as a 10-mark question, and the contents of the posterior triangle can be asked as a short notes and applied aspects. So generally the triangles of the side of the neck is divided into anterior triangle and posterior triangle. So what is this muscle? This muscle is sternocleidomastoid. So the triangle which is present in front of the sternocleidomastoid is anterior triangle, and the triangle which is present posterior to the sternocleidomastoid is posterior triangle. So the triangle which is present in front of the sternocleidomastoid is anterior triangle. The triangle which is present posterior to the sternocleidomastoid is posterior triangle. Now generally the posterior triangle is formed by sternocleidomastoid and the trapezius muscle. So now what is the boundary of sternocleidomastoid? What is the boundary of posterior triangle? So posterior triangle is bounded anteriorly by posterior border of the sternocleidomastoid, and posteriorly it is bounded by anterior border of the trapezius, and inferiorly it is bounded by the middle 1/3 of the clavicle, and apex is formed by the meeting of these two muscles, that is sternocleidomastoid and the trapezius, and it extends up to the superior nuchal line. So this is the boundary of the posterior triangle. So look at here, anteriorly it is formed by posterior border of the sternocleidomastoid, posteriorly it is formed by anterior border of the trapezius, and inferiorly it is formed by the middle 1/3 of the clavicle, and apex is formed by the meeting of these two muscles, and it extends up to the superior nuchal line. Now roof. So roof, generally the posterior triangle has skin, superficial fascia which contains platysma muscle, and external and posterior jugular veins, and 4 cutaneous nerves. One goes to the occipital, that is lesser occipital. Next one is greater auricular, transverse cervical, and the supraclavicular nerves, and the cutaneous vessels and the superficial cervical lymph nodes. And mainly the roof is formed by the investing layer of the deep cervical fascia. So now it is formed by skin, superficial fascia with platysma, and the cutaneous nerves and vessels, and external and posterior jugular veins and the lymph nodes. And importantly, the roof is formed by investing layer of the deep cervical fascia. Now this is skin. Now we are going to reflect the skin. After reflecting the skin, we see this platysma muscle. So platysma continues as rhizorius in the face. Now we are going to reflect the platysma. After reflecting the platysma, we can see this layer. What is this muscle? This is sternocleidomastoid, and this is trapezius, and these form the boundary of the posterior triangle, and this green color thing is the investing layer of the deep cervical fascia. So this investing layer of deep cervical fascia is pierced by some of these structures. So first structure is external jugular vein. So external jugular vein is formed by the posterior division of the retromandibular vein, which joins with the posterior auricular vein, and they form the external jugular vein, and which pierces the investing layer of the deep cervical fascia. And the cutaneous nerves that pierces the investing layer of deep cervical fascia is, first one is lesser occipital, which goes to the occipital region, that is of C2 root value. It goes to the occipital region, and it supplies the skin over the occipital region. The second cutaneous nerve is which goes to the auricle, that is the greater auricular nerve, which is of anterior and posterior division. The anterior division of the greater auricular nerve supplies the skin over the angle of the mandible, and the posterior division supplies the skin over the auricle. And the third cutaneous nerve is the transverse cervical nerve which is of root value C2 and C3, which supplies the skin over the front of the neck. And the fourth cutaneous nerve is the supraclavicular nerve. So initially it is arises as a single trunk and divides into 3 branches. So these 3 branches are which is present which is present medial is known as medial branch, and which is present lateral is known as lateral branch, and which is present at the intermediate is intermediate branch. So these 3 are supraclavicular nerves. So these are the structures piercing the investing layer of the deep cervical fascia. The first one is external jugular vein and the 4 cutaneous nerves. Now this point is called as a nerve point. So this area below this area we call it as a careful area of the neck. Above this area we call it as a carefree area. As there is no nerves present in this area, we call it as a carefree area of the neck. So these are the cutaneous innervation of the face and the scalp. So this is the external jugular vein which crosses the sternocleidomastoid obliquely and drains into the subclavian vein. So now, what is the floor? So floor is formed by the prevertebral layer of the deep cervical fascia. As we know, the roof is formed by the investing layer of the deep cervical fascia. The floor is formed by prevertebral fascia. This prevertebral fascia continues as an axillary sheath of the upper limb. So next to the prevertebral fascia we have the muscular layer. That is, first is semispinalis capitis, next one is splenius capitis, and next one is levator scapulae, and the next one is scalenus medius. So now we will remember this as the ship of the captain. So we keep the captain as first. First one is semispinalis capitis, next one is splenius capitis. Now the captain turns the lever, that is the levator scapulae, at the middle of the ocean. So scalenus medius. So floor is formed by prevertebral fascia and these 4 muscles. The entire 4 muscle is covered by the prevertebral fascia. So these are the muscular layers. This small muscle is semispinalis capitis, next one is splenius capitis, next one is levator scapulae, and this is scalenus medius, this is scalenus posterior, and this is scalenus anterior. The muscle which is present in front anteriorly, which is out to the scalenus medius, is scalenus anterior, and the muscle which is present posterior to the scalenus medius is scalenus posterior. For better understanding, we are going to take a cross section at the level of C2, and this is the outermost layer is skin. The outermost layer is skin. The next to the skin, superficially we have what muscle? Platysma. So next to the platysma we have the fascia, that is the investing layer of deep cervical fascia. This investing layer of deep cervical fascia splits into 2 and it encloses sternocleidomastoid anteriorly and trapezius posteriorly. So sternocleidomastoid anteriorly and trapezius posterior. And one more muscle which crosses the sternocleidomastoid obliquely before piercing is external jugular vein. So this vein is external jugular vein. So now these are the roof of the posterior triangle. Now what are the muscles forming the posterior triangle floor? The first muscle is semispinalis capitis. Next to the semispinalis capitis we have the splenius capitis. Next to the splenius capitis we have the levator scapulae. Next to the levator scapulae we have the scalenus medius. The muscle which is present in front of the scalenus medius is scalenus anterior, and the muscle which is present posterior to the scalenus medius is scalenus posterior. And these are And these are the extra muscles which is present in the back of the neck, which is not related to the posterior triangle. Now these are the muscle which forms the floor of the posterior triangle. Now this entire floor muscle is covered by one fascia. This fascia is known as prevertebral fascia. Now you have to understand that posterior triangle it is a space that is lied between two fascia. Anteriorly we have the investing layer of deep cervical fascia, posteriorly the prevertebral fascia. So the posterior triangle lies here, not here, only here. So this is the posterior triangle. So now the posterior triangle is divided into two parts by the inferior belly of omohyoid. So inferior belly of omohyoid divides the posterior triangle into two. So this is inferior belly of omohyoid, this is superior belly of omohyoid. Omohyoid is a muscle which has a superior belly, inferior belly, and this superior belly and inferior belly is connected by a central tendon which is present behind the sternocleidomastoid. Now this inferior belly of omohyoid divides the posterior triangle into two triangles. The one which is larger is known as occipital triangle, and one which is a smaller one is called as a subclavian triangle or supraclavicular triangle. Now what is the boundary of occipital triangle? Anteriorly posterior border of the sternocleidomastoid, posteriorly anterior border of the trapezius, and inferiorly inferior belly of omohyoid, and the apex is same as that of the posterior triangle per se. Now what is the boundary of subclavian triangle? Superiorly inferior belly of omohyoid, inferiorly middle one third of the clavicle, anteriorly posterior border of the sternocleidomastoid, and posteriorly anterior border of the trapezius. Now what are the contents of the occipital triangle? The first content is spinal accessory nerve, which is the 11th cranial nerve which supplies the sternocleidomastoid as well as the trapezius muscle. And what are the four cutaneous nerves? We have already seen that the lesser occipital nerve, greater auricular nerve, transverse cervical nerve, and the supraclavicular nerve. And the dorsal scapular nerve. Dorsal scapular nerve is also known as nerve to rhomboides, which supplies the rhomboides major and rhomboides minor muscle. And the branches from C3 and C4 which arises from the cervical plexus. And the vessels present in the occipital triangle are transverse cervical artery and vein, and the occipital artery and the occipital nodes. Now this is a mnemonic to remember the occipital triangle contents. Occipital triangle itself a mnemonic. O for occipital artery, C for cutaneous nerves. There are four cutaneous nerves: lesser occipital, greater auricular, transverse cervical, and the supraclavicular nerves. And the next C is for C3 and C4. This C3 and C4 supplies the levator scapulae and the trapezius muscle. And P for spinal accessory nerve, P for spinal accessory nerve, and TA for transverse cervical artery, A for artery, transverse cervical artery, and the LT for levator scapulae and the trapezius. If you forget the L3 and L4 is supplied by levator scapulae and the trapezius, you can remember by this. And R is nerve to rhomboides, which is also known as dorsal scapular nerve. So this is occipital artery which runs on the occipital region, which is when it goes to the occipital region it becomes tortuous. So next content is spinal accessory nerve which runs on the levator scapulae muscle. It appears behind the sternocleidomastoid and it disappears behind the trapezius muscle. By going though, it supplies the sternocleidomastoid as well as the trapezius. Now this is the first cutaneous nerve, that is that is the lesser occipital nerve. This lesser occipital nerve hooks around the spinal accessory nerve like this. This is an important MCQ. Which nerve hooks around the spinal accessory nerve is the lesser occipital nerve. The next nerve which goes to the angle of the mouth is the greater auricular nerve. The next nerve is transverse cervical. The next one is supraclavicular nerve. So the next content which runs parallel to the spinal accessory nerve is C3 and C4 roads, which supplies the levator scapulae as well as the trapezius. As it runs on the levator scapulae and it disappears behind the trapezius, so it supplies the levator scapulae as well as the trapezius muscle. The next nerve which pierces the scalenus medius muscle is dorsal scapular nerve, also known as nerve to rhomboides, which pierces the scalenus medius and disappears behind the levator scapulae muscle, and it supplies and goes to the back of the neck, and it supplies the rhomboides major and the rhomboides minor. The nerve with the artery which is running transversely is transverse cervical artery. So next artery is dorsal scapular artery. Dorsal scapular artery is a branch from the third part of the subclavian artery. So these are the contents of the occipital triangle, and you should add about the lymph nodes which should be present upper and lower to the spinal accessory nerve. These are the occipital lymph nodes. Now what are the contents of the subclavian triangle? So first content is a root and trunk of the brachial plexus. The second one will be the nerve to serratus anterior. As it is a subclavian triangle, it should have subclavian artery, subclavian vein and nerve to subclavian. So these are the main contents, and also it has the suprascapular artery, vein and nerve. And apart from this we have transverse cervical artery and vein and lower part of the external jugular. Why the external jugular vein comes into the subclavian triangle? As it goes down and it drains into the subclavian vein. So external jugular vein drains into the subclavian vein. So the main contents to be remembered is brachial plexus, nerve to serratus anterior and subclavian nerves and vessels, suprascapular nerves and vessels, transverse cervical artery and vein, and the lower part of the external jugular vein and the supraclavicular nodes. Now we have removed all the muscles except the scalenus muscles. We have scalenus medius, scalenus anterior and scalenus posterior. This is scalenus anterior, this is scalenus medius and this is scalenus posterior. Now these are the roots of the brachial plexus and the trunk of the brachial plexus which emerges between the anterior and posterior scalenus muscle. So trunk of the brachial plexus, it emerges between the scalenus anterior and the scalenus medius muscle. Now what is this vein? This is the subclavian vein which is present in front of the scalenus anterior muscle. So these are the nerves that arises from the upper trunk of the brachial plexus. The one which is below is nerve to subclavian and one which is above is nerve to means suprascapular nerve. The artery which is present behind the scalenus anterior is subclavian artery. As I have mentioned, this third part is the subclavian triangle contains a third, means content of the subclavian triangle is third part of the subclavian artery. So I have mentioned this as third part. Actually the first part of the subclavian artery lies before the scalenus anterior muscle. Behind the scalenus anterior muscle we have the second part, and after the scalenus anterior we have the third part. So this is the third part of the subclavian artery. So remember, in front of the scalenus anterior we have the subclavian vein. Behind the scalenus anterior muscle we have the subclavian artery. From the first part of the subclavian artery, the first branch is vertebral artery, VIT. We can remember this as VIT. The first branch is vertebral artery, second branch is internal thoracic artery which enter into the thorax, and the third branch is T for thyrocervical tract. From the thyrocervical trunk, we have two branches. The first branch is transverse cervical artery and the second branch is suprascapular artery. These are the arteries arising from the thyrocervical trunk. So these are the contents of the subclavian triangle, and importantly we should add a note on the supraclavicular lymph node, which is present between the subclavian vein and the subclavian artery. So applied should be added, or Virchow's node. Virchow's node is nothing but enlargement of the left supraclavicular lymph node. If a patient comes to you with the left supraclavicular node enlargement, you should suspect the malignancy of the stomach, gallbladder, pancreas, kidney, testis, ovary, anything related to the abdomen. So secondly, you can add a note on brachial plexus block. So brachial plexus block is the anesthetic agent is injected into the brachial plexus so that the area supplying by the brachial plexus gets numb, so that any procedure can be done over the arm. Thank you.